Good morning, everybody. It's Teepa and Matthew, and today we're going to dig into a question that y'all brought up about what's the difference between Lewy body and Alzheimer's. Okay, and I would say 20 years ago, most Lewy body was misidentified as Alzheimer's plus psychoses,
They just,
or Parkinson's with Alzheimer's.
yeah.
Uh,
Which, I mean, and in all fairness, even before like they really started getting better at saying Alzheimer's, it was all psychoses, and they were
what
sticking
was all
people in,
psychoses? It was senile dementia.
yes,
Yeah, I mean, it
they
was
were
all
putting in
messy.
asylums and
Yeah,
like just
and
saying they're
yeah, and
losing
Lewy
it.
body was so
So,
rare. I
oh,
mean, I was told by a neurologist. I remember this was way back when I was teaching at UNC, and I was going, "Wow, I see a lot of Lewy, but no, you don't. You see Parkinson's." And it's like, I don't think it's Parkinson's.
whoa.
This is different. And no, 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 I am a neurologist, and it's like,
Well,
cool. I'm glad you're a neurologist, but you aren't out where I'm at. And I'm telling you that I am seeing a lot of misidentified, mismanaged people because you, my friend, along with many others, were giving them haloperidol,
mm,
a lot of it.
oh,
And you were trying to treat what you thought was a schizophrenic type psychosis, when
oh,
in fact you were trying to manage Lewy body,
yeah.
which you didn't understand. So,
That sounds like it went way deeper than just thinking a diagnosis is something more than the other.
yeah. So, I
That's
mean, they would, I mean, it was, I mean, I did talks in many, many states and areas where we were talking about here's your symptom profile. If you're seeing this, be super cautious about antipsychotic medications. Be super aware that falls are a very, very high risk. Be very aware that somebody's knocking things over and doing things like that. That isn't really Parkinson. That's called an intention tremor. That's very different than a resting tremor, which is what somebody with Parkinson's might have. And a benign tremor, because this isn't benign, it will also like sort of show you like in sleep disturbances, like people are up all night,
yeah.
and they're seeking and trying to get out of places, and they're thinking they also don't have just a memory lapse. They don't have missing memory. They have make stuff up. It's called confabulation. Their brains are making up stuff, particularly around awful, nasty, bad stuff sometimes. Like they think you have done things you haven't done. They can't trust you anymore. They're delusional thinking. So I think people have had sex. I think they've stolen things. I think, there's little children trapped places. I'm also seeing things that aren't there. Visual hallucinations, disturbances. I see lines move on the wall, shadows that are people coming down from the ceiling.
Yeah.
I see reflections in glass that I know there are people out there trying to get in. And this is early.
Yeah, our friend Curry over at the Lewy Body roller coaster, he had shared out about seeing a lot of stuff that did not make sense to him, but seemed very real driving his
Yeah,
truck.
when he was
And
driving.
yeah,
Yeah. So, so what I just gave you was sort of a laundry list. And I'll go ahead and I'm going to share a slide because we've actually tried to help folks. We'll get on to the Alzheimer's side of the street. But if these are sort of some of the things when I say this stuff, you go, oh, wait, that sounds like, like pause, because more than likely, see, it takes on average 25 years for something that we've discovered in medicine to make it into more common practice.
mm,
And you have to be paying attention to it to want to incorporate it into your practice.
mm,
And the thing is, way too often in the healthcare area, nothing's really changed about dementia, except, well, now there's these meds that you can sort of infuse and they slow the disease down. So maybe I'll just sign people up for that. It's like pause, 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 pause. Because once again, it's like putting everybody in one cooking pot and turning the heat up. And it's like really not a good idea. Not a good idea at all. So I'm going to share. Go ahead, Matthew.
and as you're bringing that up, Tipa, so this is why I think often when people ask you, okay, so who should I go to? I feel like I've heard you say consistently, okay, find a doctor who is working with people living with dementia, who has experience, who's been doing this. That's like almost their focus and what they do in their practice. Because exactly what you're saying, if they haven't been intentionally doing that and they've been more on the other side of the road or in something different, it
Yeah,
is that much harder for them to pick up on these things. The
for
experience
sure.
that it takes for that.
Yeah. And I mean, this umbrella has changed so dramatically over the 40 plus years I have been in practice. This looks nothing like the original umbrella we had. It would have said organic brain syndrome, and then under there would have been senile dementia, and then there might have been senile dementia Alzheimer's type. I mean, that's where we were back in the day. Now we have this cat, and this has changed for us over the last 5 years. As a matter of fact, late over here, LATE, TDP 43 is a brand new one that has just really been worked out and understood that not old people don't necessarily get Alzheimer's. What they get is LATE, which is limbic predominant age related TDP 43 encephalopathy.
Encephalopathy.
And it has taken me close to these 3, 4 years to be able to say that without stumbling over it.
Yeah, that would. I'd still have to
It's
work
a
on it.
tough one.
Yeah.
But where we wanted to focus now is Lewy body. So it used to be that Parkinson's was the big drop. Parkinson's related dementia was the big drop. Now it's Lewy body because it's synuclein protein malformations. We know that. And they're both involved in Parkinson's and they're also involved in diffuse Lewy body disease. So, what we know about Lewy body is early signs will be movement problems, freezing. It could be having problems with keeping yourself upright against gravity, falls, visual disturbances or hallucinations, delusional thinking, fine motor problems, either using your hands with skill or swallowing with skill. You might have coughing or choking episodes, and then they go away. You might have episodes of rigidity or syncope where you lose your blood pressure and your heart rate and you drop, like boom, boom, you pass out, and then you're back. Insomnia or sleep disturbances. And you may have restless leg syndrome where you're up and moving, but you're asleep. You might have nightmares that seem real. And so the next morning you think people have done things. You will have fluctuations in ability. You can go from being really able to being totally unable. You could have drug reactions. About half of people with dementia do have drug reactions that are extreme. They're extreme, they're strange, they're off the, I mean, it's called paradoxical. And the tricky part is it can be misidentified as a psychiatric illness.
Yeah.
Now, if I go through all those, Matthew, and then you look at the next first column, which is Alzheimer's, what's the first thing that jumps out in your mind as you look at that? New details are lost, recent memories more problematic, some language problems,
Yeah.
impulsive, indecisive, gets lost in place or time. There's lots of different types. What do you what? And it's beta amyloid and tau is what
Yeah.
it is.
I feel like I'm seeing more like direct brain related
Mhm.
shifts, especially with memory or newer pieces versus like the Lewy body side seems more like we see more psychosis. Again, why it's so hard sometimes for doctors to be like, well, I think this is a mild psychosis and there's nothing else happening here. But noticing that big difference between the two. There was one other piece too I picked up on Teepa. There was a lot of you saying you may or may not
Mm,
as you were
yeah,
saying some of the symptoms may or may not, and that being a tricky
yeah,
thing too because I think for some folks they really want it black or white. It's like,
yeah.
well, it's either you have all of these and so officially you do have it, or if you're missing some of those, well then you're not. And the difference that that makes in that understanding, because sometimes it's presented as like, okay, well you got to have all of these for it to be this, and that's
Yeah,
not the
no, and if you
case.
have five of the laundry list I gave you, then it's probable. Now, the thing about Lewy body, if you're early and you're wondering, one of the things they can do is they can draw some cerebral spinal fluid off and sort of see whether or not you have any synuclein protein or alpha, whether or not you have beta amyloid or whether you have some tau so you have a change in your cerebral spinal fluid, which is
Right.
increases the probability they're on target. But they can also do skin biopsy or not, it's muscle biopsies.
Oh.
And they take a little plug of muscle out of your trapezius, they take one out of your thigh, they take one out of your calf.
Hmm.
Now, that doesn't sound too bad unless like you're already having symptoms and somebody's digging things out of you and it's like, I don't know whether that's going to go so
Yeah.
well or
Do we need to go that road or not? Yeah. Yeah.
yeah. And I need you to go to the doctor. So these are things where a conversation is probably the thing to do. So tell me a little bit about how things have been going. What are the things you're noticing first? Because people, here's the bad news, people can have both,
Mm-hmm.
or they have start with one and get a second one. Um, and these are certainly not the only dementias, but these are ones that if you miss early signs, it tends to create lots of tension in the family, in relationships, and it can really change the whole course of life for many people. So, you know, in my world, it's like, hey, you know what? Let's get curious. Let's explore and let's do it together. It's like, have you ever heard of anything called Lewy body?
Yeah.
And the answer is no. What is that?
What
And
is
it's
that?
like, okay, well, let's start. How do you spell it? Is the first thing most people say. How do you spell that? And it's not Louis like Louie.
Luie,
It
yeah.
is Lewy. And they were Lewy bodies, which were these granulation tissue that was found in the brain upon autopsy of somebody who had Parkinson's, but also had all these other psychiatric symptoms. And so that was Dr. Lewy, who was the first person that saw that. So he got to name it, just like Dr. Alzheimer's got to name his, Dr. Parkinson. So these came from doctors who were curious about the people that they treated and unsuccessfully treated typically. And these people were institutionalized. And the person that Dr. Alzheimer's treated was actually a young onset Alzheimer's, not a late life onset. And she was in a psychiatric facility because of her symptoms. But we know young onset is different than late life onset. So, what can I say?
This is not easy. This is not
This is
easy.
not easy. And what I would say is stay curious, don't get overwhelmed. However, if what you feel like is you're not getting good information from your provider, raise your hand and say, I think I need more help. If you have somewhere I can go and find out more things, I don't want to bother you, but I need more information.
Yeah.
And if the person doesn't, ooh, then maybe it's time to get help somewhere else because we don't want non treatment or mistreatment to be a pattern for people. It's just not okay. It's
No.
time to break that cycle. And we're into radically changing how dementia is viewed and lived. So, for everybody out there, thank you for what you do. Thanks for making a difference in people's lives and advocating. And thanks for being curious. Till next time, take care of yourself, take care with your care, and stay curious. Bye, everybody.
Thank you, Teepa. Bye, everybody.